Hi, everyone. Welcome to the Harmony Foundation podcast series. And it's my pleasure today to be joined with Bree Neal, Susan Anson, and Mike Lyons with the CeDAR Boulder Outpatient Clinic. Welcome, everybody.
Thank you.
Thank you.
It's good to have you here. So before we get into specifics about your program and what you all are doing, I'm curious to hear more about your backgrounds and what got you into the field. So Bree, let's start with you first. Sure. Tell us a little bit about your background.
So I've been in the field in one capacity or another for about 10 years, and I've been working with individuals with severe mental illness for a lot of that time, but I've also worked in detox facilities, inpatient facilities, treating addiction, and really came to see how integrated the two were and how really that's the direction that the field was moving. And so I went and got my LAC and really fell in love with the MI process and helping people to navigate what their recovery is going to look like and being a piece of helping them to get there. So
that's great experience.
Yeah.
Good. How about you, Mike?
So I started in the industry in 2010, and I worked at an outpatient private practice where I did DUI groups, level 2 education and therapy. Also did a lot of court-ordered mental health and drug and alcohol assessments, had an individual caseload, all outpatient stuff. I worked there for about 3 years while getting licensure hours and supervision necessary to get my LPC. And then at that point, I applied to CeDAR and got hired, and I had been at CeDAR ever since. So I started at CeDAR in 2013 and worked in their residential program for 3 years, and then transferred up to our Boulder Outpatient Clinic November of 2016. And here I am.
That's great. Good to have you here.
Thanks.
Yeah.
Thank you.
Now, Susan, you're no stranger to Harmony, but you're now working in the CeDAR program as well. So tell us a little bit about your background.
So I actually came to Harmony Foundation to get sober in 1995, and through that process I became intrigued with the field and really wanted to help. And so I came to Harmony and did my internship, and then left Harmony after being employed here for a time to attend a master's program. And from that, I went on to work in the prison, worked in the serious and violent offenders program, and then spent an extensive time in Phoenix in the eating disorder field and worked at a inpatient facility there, and then came back to Colorado and have worked inpatient with CeDAR for the last 5 years, and now have this opportunity to be here at the Boulder Outpatient Clinic.
That's great.
Yeah.
So you all have great cross-section of resources available between the work that you do with mental illness and mental health. Obviously, your background in recovery, eating disorders, and then, of course, your addiction experience. That's great that Boulder has that now in this community. So let's talk for a few minutes about the new program, Susan. So CeDAR's been in Aurora, Colorado for about 11 years. It started as a residential program. It's tied to UC Health. They just opened the new clinic in Boulder in November. So can you describe what a client would experience when they come to do services at your program?
Certainly. So they would have an opportunity to have a warm welcome, of course, and be thoroughly oriented to our program. And what they would experience is a visit with the psychiatrist to do medical assisted therapy, as well as an IOP program, and individual sessions, as well as an opportunity to meet with an addiction specialist in terms of addictionologist to maybe address pain issues.
Great. Okay. And so, Mike, you are working as one of their primary therapists in the program, and your background obviously is you're very patient-centered. Can you talk to us a little bit about what that would look like for a client coming into the program?
Sure. So the client-centered modality, the main tenet or the main belief behind it is that essentially establishing trust and building rapport with your patient or client are sort of the utmost importance early on in the therapeutic dynamic. So from my perspective and in my opinion, it's kind of a no-brainer that you're not really going to get anywhere clinically until there is that level of trust and there is sort of a warm, caring, nurturing environment that's been created on my end. And so clinically, I think that's really important as far as my approach goes. And that's definitely something that takes priority early on in the dynamic is creating that relationship, establishing trust, and creating rapport, creating a safe environment for the client to feel.
Well, and obviously the success rates for long-term recovery help when you have that relationship fostered while they're in the program.
Yeah, I think that the outcomes speak for themselves, and I would kind of go out on a limb and say that the majority of the clinicians at CeDAR come from sort of a client-centered, person-centered orientation.
It's a great step down as well.
Yeah.
Which is good.
Yeah.
So Bree, first time on campus here.
Yeah.
So what are your thoughts?
You have a beautiful campus here. I've been really impressed, and just the staff is so welcoming. And it's been wonderful to be able to really get to know Harmony's program and figure out how we can collaborate and see really the comprehensive services that you provide to your clients. So I appreciate being so welcomed here.
Thank you. We look forward to future partnerships with CeDAR, particularly now that you have this intensive outpatient program. We see a lot of great opportunity there. If someone were trying to access services at the clinic, how could they get in touch with you?
Yeah, absolutely. So the best number to call for local admissions in Boulder would be 303-544-3630, and they would be speaking to our patient access representative, Sarah. And then you can also go on our website to get more information, and that's www.cedarcolorado.org, and there is a Boulder tab that can give you some information on what services we offer there.
Sounds good.
Yeah.
Well, thank you all for taking the time to come up the mountain. We
Yeah.
really appreciate having you here.
Yeah, thank you.
Thanks for having
Thank
us.
you.
For those of you that are interested in learning more about Harmony Foundation, or if you need someone who needs help right away, please give us a call at 866-686-7867.